Year over year, you're going to see tier movement for drugs, and I don't think that it's necessarily because of the $2,000 out of pocket. The clients that we work with as they get ready for each formulary year are looking at a few different things, right? So of course, tier placement matters, the cost of those drugs matter as well. And so that's number one. The other thing that we also look at is ensuring that there is appropriate coverage of drugs across all the therapeutic categories that plans are responsible for covering. The other thing that's factored into that formulary management and design is really trying to make sure that the right beneficiary is on the right medication, and that's done through utilization management edits. And then, to be honest, many of my clients are very hesitant to make negative changes for their beneficiaries year over year. So, you know, if the cost of the drug has gone up, sometimes that does just in and of itself lend itself to changing tiers. I think we're actually gonna see, and again, we're not gonna know, today is October 15th, so our first day of open enrollment, but we're really not gonna see how that membership shifts, right, until we get through open enrollment. But I would really see it from the perspective of, if you're in a traditional Medicare and traditional, Medicare, you still need a prescription drug. And so that's gonna be a standalone prescription drug plan. And because of this increased risk and liability to the plans, we're seeing a decrease in the number of PDPs that are out there in the market. And we're also seeing an increase in premiums. Now, CMS did put out a program that PDPs could opt into, and so it has limited that cap to a $35 increase in premium for what plans elected to participate in that. But what I think we're really going to see is a shift to MAPDs because of the additional coordination of benefit that you get with an MAPD. Again, MAPDs oftentimes have supplemental benefits that the member may not have with their other options. And then also, again, like I said, MAPDs have more avenues and mechanisms to spread out the increased financial liability and risk. But I think just because of the fact that we're seeing this decrease in the number of PDPs as well as that increase in premiums, I think more Medicare beneficiaries are going to start to look and see, is an MAPD potentially an option for me?